We are discussing various routes of hysterectomy today. Now, often patients are stuck in a medical situation where hysterectomy or uterus removal surgery is the ultimate treatment for their gynecological complaint, and they are advised to go for it by their treating doctors. Now, the thought of uterus removal itself sounds so scary to them, and on top of that, they are completely unaware about the various routes of surgery. Now, this video aims to shed some light on these common queries so that your apprehension and anxiety before the major decision both are taken care of. Hello all, I'm Dr. Deepti Asthana, Director of Kalosa Clinic and also working as Senior Gynecologist in Fortis Hospital Gurgaon. Stay tuned till the end to have complete insight about the routes of uterus removal surgery with the importance of each route. Log on to my websites for more knowledge about female reproductive health, drdeeptiasthana.com and Laparoscopic-Assisted, and follow me on other channels like Instagram. If we talk about uterus removal surgery, it is the second most common surgery women undergo after cesarean births. So, it is not an uncommon surgery done by us gynecologists. Now coming to the various routes of hysterectomy. A holistic approach is of utmost importance when deciding which modality is best for you. Now don't assume that what worked for your friend or neighbor will work for you also. Each individual is unique. Your requirements may vary from those of your associates. Now as specialists, we are always available to brainstorm with you and choose the most appropriate plan for you. Now let us discuss the advantage and disadvantage of all the available options. Now coming to the first option, which is open hysterectomy. Now this is the traditional method of hysterectomy performed with an abdominal incision of about 5 inches along the bikini line to minimize visible scarring or vertical if the mass or uterus is too big. Now the surgeon can more easily see and feel the uterus and the surrounding area, and this may be an advantage when a fibroid tumor is particularly very large. Now also, candidates with contraindication to laparoscopic surgery usually undergo this surgery. Now with an open surgery, there is usually slightly more pain and a longer recovery time. Now coming to the second one, which is laparoscopic surgery, which we also call as total laparoscopic hysterectomy or TLH. Now this is the most preferred route of surgery these days, the laparoscopic hysterectomy. Now special surgical tools are inserted through small abdominal incisions to remove the uterus. Laparoscopic surgery can now be performed for almost all the conditions that need open surgery. Now, whether it's a complicated surgery with previous abdominal adhesions or something more sinister like reproductive cancers, laparoscopic surgery gives you the best view of surgery and ease of surgery. Now, laparoscopy can be used for management of the following conditions such as endometriosis, ectopic pregnancy, ovarian cyst, pelvic inflammatory disease, fibroids, adenomyosis, gynecological cancers, sterilization, etc. Now in laparoscopic surgery, 1 centimeter incision is given around the belly button, which is made from where a long probe with a camera at one end is inserted into the abdominal cavity, and subsequently 3 small 0.5 centimeter incisions are made to insert the medical instruments needed for the procedure. Now studies have shown that laparoscopic surgery causes less trauma, less blood loss, faster recovery and reduced hospitalization. However, it is costlier than traditional surgery and has certain limitations in people with other medical conditions such as obesity, heart disease or large abdominal masses. Now coming to the third one, which is the robotic surgery. Now for robot-assisted procedure, the surgeon controls the laparoscopes with robotic arms. Now though this surgery is the best preferred technique for most of the indications, but this facility is usually not present everywhere and it is the costliest of all. Now with experienced hands, this is the best route if indicated. Now coming to the next time, which is the vaginal hysterectomy or VH. Now in vaginal hysterectomy, surgery is done through the vaginal end. It is a preferred method if third or fourth degree of uterine prolapse is there. Now, there is no external skin incision and surgery is done through the vaginal canal. Women with scar tissues from a cesarean delivery or extrauterine disease such as endometriosis, severe adnexal pathology, or with an enlarged uterus, vaginal hysterectomy may not be the first choice for these patients. Now coming to the next, which is laparoscopically assisted vaginal hysterectomy or LAVH. Now this route has the advantage that the top pedicles of the uterus are cut laparoscopically and rest of the steps are concluded vaginally. Now this is for the surgeon's ease, and post-operative recovery is little quicker, but the operative time is much more as compared to the vaginal hysterectomy. Now these are all the various routes of uterus removal surgery. Before going for the surgery, you should always weigh treatment options thoroughly, as hysterectomy is an irreversible surgical procedure. Now women absolutely need to make sure that they're making the right choice for themselves. I'd always discuss all the possible routes with the patients because as they're treating gynecologists, it is my duty to apprise them of the risk and benefits of each modality. Of course, your opinion matters, but please go with the decision of your treating surgeon. Now, hope you liked the knowledge shared in this video. Do like and subscribe my channel Kalosa Gynae for regular inflow of videos. Stay safe, informed and healthy. Goodbye.